Well, like Dr. Gordon says, we all have cancer. The question is, do you have enough cancer that it clusters into a lump or bump that then they detect? Because I know in Europe or somewhere they have a blood profile test where you can get a pretty good idea of how high your cancer level is.
That's in Japan. Yeah.
Japan, and you keep it low enough that it's never a problem.
Is it effective, would you say, that
Yeah.
test?
Yeah,
Yeah.
Why don't they do that here?
because the cancer cartel would go under.
Politics, yeah. So politics. Yeah. Modern medicine is very beautiful. If we could use what's out there, we would have a solution to almost everything. But there's so many special interests that are.
Yeah, right.
Oh.
So this was the fifth category. These are the 5 things that come in. Yeah, and remember so far, just to be loyal to my teaching and to what we've discussed over the last few months. I made recommendations for lab tests only worth, if that, maybe a total of $1,000, but not $20,000 or $40,000 like some of the kids have spent. They come to me, and the minimal lab test is the $25 or $30 hair analysis. So depending on who the mom is, what the family is, you can use more of your intellect and address these issues by reading, getting cognizant, and then eliminating these factors just based on your knowledge. Then you do not need any lab testing.
Right.
And the more lazy you are, the more you want to be served and not do your own work, the more lab work you have to pay for. So I just want to be very clear here that ultimately, to get an autistic child well, I do not believe that we need any lab work at all. We've done all the lab work. We know what the basic mechanisms are. We know what the solutions are. We just need to weave our way through that intelligently, to the kid as well.
And don't you think the best diagnostic by far is just educated observation of these kids?
Absolutely.
As soon as you kind of get this global picture of what's going on with them, then when you see behaviors, I know Karen Schlemak from Special Foods, which is a program we did, which I wouldn't suggest to anybody, but she had a really good basis for understanding that if your child is stimming, they're probably seeking out a specific input. Like, for example, she had a child who flushed the toilet all the time. Flush, flush, flush. Well, they put a chlorine filter on the toilet, and the kid stopped flushing it. He was getting high off the chlorine fumes coming out of the toilet. And her whole thing was, as you get more educated and you really get what's going on with these kids, they're simply trying to feed that which they need. So when you see these behaviors, you'll be able to pick out where your problem spots are. And for example, most of the moms I hang out with know when their kids really, really, really want some kind of food, it's a problem. And it's one of the first things they eliminate because they figure, oh, it can't be good,
But remember, these are all the outcomes, of the primary mechanism up here.
Right.
These are all the outcomes that then we have to deal with on a daily basis, and that's really where you shine. To the day-to-day management of an autistic child, which is for me as a physician not my strength, because I don't have to live with these children, But I can give moms guidance and say, don't forget the primary mechanism is this up here, and then we address these issues as we go along to make life easier for anybody in the family. But it's not going to fix the problem. What's going to fix the problem is stopping the toxic input, and then what we want to talk about now is cleaning up the input.
What I'd like to go to is one of the next sections was make your mind to make it happen. And under that were the 5 levels of healing and the healing continuum. And what I wrote about there was if you can't see your child healing, if you don't believe that your child can heal, quantum physics is going to come on in and make it not happen versus happen. And it sort of led beautifully into your 5 levels of healing and then the healing continuum thing that I sort of came up with.
Then, not to interfere with your order, but if you did Doc's order, going with that first, and then add that as a supplement to it, it seems like that may be a better flow. That's just
it's just I know the 5 levels of healing at minimum is a foundational piece that you go from.
And then let's do this. Let me just finish on what we discussed yesterday was basically the 5 mechanisms by which toxins come in a child, and then yes, there is the genetics, and there is the 5 levels and the 7 factors that we talked about, and then there is the pumps that we need to turn back on, how to get the
Okay.
toxins out.
Yeah.
And I want to, I think, just finish that part up,
Sure.
and then we're going to go very step by step through all
Okay.
these things. Yeah, and so what I like to discuss is just give a very simple list of the available detoxification agents. Yeah, I
Okay.
think it would be a good place to do this, to just kind of go through the list. These are the tools that we have available for detoxification. Is it okay?
That's good. The only pause I have is that I feel like in the world of autism, we're so stuck on the biochemistry of this whole
Yeah,
thing,
yeah.
which is where the detox agents come in. And without an appreciation for what you, one of the biggest things you bring to the table, which is at least a global appreciation for the 5 levels of healing, we go right back to sort of that biochemical place. But that's fine
Well,
if you feel
not
like that's
necessarily,
more.
because in
Okay.
my detox, in my overview of the detox agents, I certainly go up
Through
the
that.
levels.
Okay. So you kind of have a detox agent to match the different. Okay,
Yeah, so
perfect.
detox, we do on different levels. One level of detox is on the biochemical level,
Okay.
and then the next level of detox has to be on the electromagnetic level, the
Okay.
energy level, energy medicine level. Without that, I have not seen people get well ultimately. And then beyond that, there is a level of the psycho-emotional issues that have to be addressed in order for detox to be successful. So I will just kind of go through that rapidly.
Okay.
Yeah? So the when we talk about the biochemistry of detox, there's only a limited number of things available. One foundational mechanism is, I discussed it yesterday, to just simply replenish the minerals.
Huge.
When toxic metals attach only in places that are meant for metals to attach, but they're meant to be for magnesium, for zinc, for boron. They're not meant for mercury and aluminum and cadmium. Those have no roles in our physiology. However, if you're mineral depleted, that's where the toxic minerals attach. Or if there's a lot of more exposure to toxic minerals are easier available than good minerals, then those places fill up with the toxins. The most simple detox is to replenish the healthy good minerals in high amounts, to saturate the body with good minerals, and that will competitively displace the toxic minerals. They have no place to attach to. That's mechanism number 1. Mechanism number 2 is what shuttles toxic metals from their attachment sites to the way out is largely 2 things. It's the amino acids and it's cholesterol and the lipids, the lipid portion. So it's the fats and the amino acids. In terms of the bigger molecules, it's also porphyrin, the breakdown product of hemoglobin. So there is some other mechanism. But the big ones are the amino acids and the fats. Therefore, the foundational thing for any detox program is to give a high amount of minerals, keeping in mind, for example, that when you give zinc, you deplete copper. When you give copper, you deplete zinc. That these need to be kept in a certain balance. There's a similar competitive mechanism between magnesium and calcium. They need to be sort of kept in balance. In terms of products, I'm not going to make a recommendation because I have not been ultimately happy with any mineral product. But
I want for you to try.
the kids certainly need a calcium magnesium supplement. They certainly need a trace mineral supplement that has all the other minerals in it. No question. With every meal, minerals should be in food, which they're not. And therefore minerals should always be taken with the meal, not away from the meal. That's very important. The amino acids.
Can we pause on the calcium magnesium thing? Because I feel like the smartest people that I've ever talked to really feel like you need more magnesium and less calcium.
Well, yeah, you need more magnesium than general believed, especially with the detox. Many of the detox enzymes are magnesium dependent enzymes. But for example, we just looked at the test of his child and he was highly calcium deficient. Do not overlook that. So in a hair analysis, usually you can trust the calcium magnesium, and so with a $30 test you get some very good guidance as how you need to tinker with that. And I use the hair analysis a lot as a simple way to give some guidance. Okay, do we need more magnesium really, or don't we? And minerals, the most important mineral for detoxification is selenium. It's part of the glutathione mechanism. Sulfur is very important. Many of the amino acids necessary for transport of metals are sulfur-dependent amino acids. So we look in the hair analysis. Calcium, magnesium is very important. Sodium, potassium is very important, the electrolytes. And in terms of the minerals, I'd say for detoxification, the most important one is selenium. I think there's insufficient amounts there, and sulfur. But all the other ones we also look for. So that's number one of detox. Number two, to get the cholesterol to cooperate with the transport of toxins, and to get the cell wall, the pumps in the cell wall working properly. It's all in the fatty acids. And I strongly hold the position that every autistic kid should have a high input, supernatural input of fish oil, of a clean fish oil that is not mercury contaminated. And we use either Carlson's cod liver oil. I mentioned that yesterday.
Right.
Nordic Naturals, the website of Dr. Joe Mercola, as a resource of finding these clean fish oils. However, some autistic kids also need some omega-6 fatty acids, sunflower oil, evening primrose oil, and so forth.
And then the ones with pyroluria, if they...
Well, that's a different. And pyroluria really relates, to zinc and vitamin B6.
I know, but can't they not handle the cod liver oil until they get some arachidonic acid on board? No?
There's different opinions
Okay.
on that one.
Okay.
Yeah, but I like to for now park that issue.
Okay.
To get scientific with the fish oil, there is a red blood cell membrane fatty acid test, which I have not found to relate with real life that great. Muscle testing has been the best guide with the oils. However, what we found is very, very helpful to moms when a kid acts up and the kid is already taking fish oil, which is omega-3 oil. Give him some omega-6 oil, give him a couple of capsules of evening primrose oil to chew on, and see if the kid slows down. And then you can immediately see the benefits from it within an hour or so. If the kid is deficient in those oils, it will show simply by a therapeutic trial of the other oils. The leading oils in autism is coconut oil, ghee. That's a way of gently warming butter up and putting it through a filter, and it eliminates all the protein particles that are in butter.
So they don't need to be scared of it, even though it's from a cow?
No.
Okay.
No, because that eliminates all the allergenic components of it. And it's available in all the health food stores. It's part of Ayurvedic medicine. So ghee, coconut oil, fish oil are the three most important ones. Some kids really need olive oil. Some really do well with the evening primrose oil, the omega-6 oils. I rarely seen somebody do well with safflower oil. It's out. Sunflower oil, I've never seen anybody benefit from that. Canola oil is probably the worst.
These kids almost universally have an allergy to canola oil.
There's an oil available in the health food stores, an oil mix. It's called Udo's oil. Udo Erasmus is one of the leading oil guys. Mary Ainig and Udo Erasmus are the guys to read up on. I, in general, recommend put the kid on a good base of fish oil, fairly high dose. You can read up the dosage at Joe McClur's website, and then do a therapeutic trial with the other oils and see which one seems to slow down the kid if it's too active, or which one gets the kid more active if it's slowed down. In general, it's fish oil is the slow down one, and the omega-6 oils, the plant oils, are the ones that are activating